Hi, my name is Abhishek Tukana, and I'm here with my colleague Michael Agnew to talk about the data response that we've had to COVID-19 using Qlik in the Department of Health. So, let's get started. I think we'll all agree, last year was a bit different. Everyone in the workforce was forced to shift gears and adapt to the ever-changing requirements of the new landscape that COVID had caused. I'd like to share some stories on how we've been able to utilize the centralized data approach and use Qlik in its many facets to deliver some great results within the department and externally. This has included using end printing, Qlik Sense as a data visualization as well as a light ETL tool, and the spin-up and integration of the Qlik Analytics Platform within the department. Now, to start with, QAP has probably been the largest technical achievement on the Qlik front within the last year. At the beginning of the pandemic, it was clear that the Department of Health would need to be the strong and consistent single source of truth for the coronavirus statistics. We would be providing statistics curated daily by the National Incident Room to the greater Australian public, and as such, there was no real room for error. We needed something quick and reliable, and there were 3 or 4 BI tools within the department that we could have used, but none of them would meet all the requirements in an end-to-end approach, going from ETL, dashboarding, physical reporting, and web integration, and as such, Qlik was the best tool for the job. Because it's one thing to generate a static report and a complete other to have a rapidly updatable report with a consistent look and feel from a reliable source of truth. So, what we needed was to have a rapid solution, to have it externally facing, to have it completely unauthenticated as such to be integrated with the website, and have it quickly updatable as the data came in. So, how do we do? Now, understandably, there was an extremely high demand for this type of content. There were rapidly shifting timeframes, and at one point the Prime Minister even made an announcement that ensured that we had to get this data out ASAP. Within 3 weeks, we were able to rapidly generate a prototype, installing QAP on an AWS cluster, neither of which we had done before. But once we had that, we had a platform to be able to validate, test, update, finalize, and then get sign-off. We experimented with iframes, web APIs, load balance clustering, and caching until we had a reliable solution that would meet our requirements. This would need to support 500,000 hits a day and up to 5,000 hits a second. And we were only advised after we had gone live after 7 weeks that this was the only QAP installation to meet these type of load requirements within the Southern Hemisphere, which was a great achievement for us. One of the other things we had done is we had built a centralized dataset, so we had the single source of truth we had been after. So, what did this facilitate? Now, a few weeks into this process, we were approached by a team working with the Chief Medical Officer, Dr. Nick Coatsworth. He was doing press releases twice a week and needed a dashboard with up-to-date figures to be able to talk to. And we were able to leverage this common data model we had generated to provide the correct statistics every time. And using the power of end printing's highly customizable outputs, we were able to meet their requirements very quickly. The first prototype for this was generated in an afternoon, and after some back and forth, we received sign-off. Now, these presentations were filmed twice a week, based on data that was only approved and available to the team at most 30 minutes prior, and that was if we were lucky. But still, these presentations needed to use the most up-to-date and accurate data available, so there was no room for error. After this, we were able to identify further opportunities for this process to save time and provide value, one of which was the Prime Minister's placemat. Now, this was originally built as a completely manual prototype. It was essentially a picture where people would go in and update the numbers manually to get the results. Understandably, this was extremely slow and also introduced risk of potential manual error. So this was identified as an opportunity for Qlik to really shine. We were able to streamline the process to generate this data and automate the pipeline, which was previously taking analysts from the National Incident Room 5 to 6 hours every single day. This allowed the analyst to focus on the consistency of the statistics, rather than the minutiae to generate them. Now, these have been primarily our externally facing successes, but we've had just as many internal successes using Qlik to provide value to our staff and our key stakeholders. I'll pass over to Michael Agnew now to talk about some of our internal success stories.
Pandemic incident management within the Department of Health was equally important to make sure that we were still meeting our critical business functions while we were reporting on all the COVID analytics. In particular, we needed to monitor workforce shortages and anyone who is in testing or isolation for COVID. We also needed to set up remote working for all the department staff to comply with the lockdown measures during the height of the pandemic. And it was very important to monitor the IT capacity to make sure all the staff could continue their functions working from home. We used end printing to combine data models from different Qlik apps and build them into one executive summary report which was easily digestible. Another critical function was assisting the National Incident Room and the Therapeutic Goods Administration, who were interested in the availability of certain medical devices, such as ventilators and personal protective equipment, and comparing this to current hospital data, patients, beds, and equipment. We did this by integrating the medical devices data from the Australian Register of Therapeutic Goods with current hospital data from the Critical Health Resource Information System. This was updated daily to facilitate strategic data-driven decision-making, especially to help TGA track any recalls or cancellations in their regulatory activities that might impact the COVID situation. Thinking more medium to long term, we integrated 18 different datasets identifying vulnerable cohorts across the Australian population by socioeconomic status, chronic diseases, disability, and remoteness. And we needed the Qlik Associative engine to combine all this multi-grain data into a single coherent data model. Then we used the front end, the dashboard, to easily find correlations and trends between these datasets, and then drill down into age, gender, and geography to find areas and people that were most at risk. This was designed to enable data-driven decision-making during crisis situations like COVID and the bushfires. Now, taking a step back and looking at the full end-to-end process, we wouldn't be able to deliver all these outputs without a good data governance process in place with the single source of truth and common data models. To facilitate this, we built a data catalogue in Qlik Sense to monitor the 60 datasets which flow through to numerous reports, outputs, and stakeholders. And again, the Qlik Associative engine was our best friend to handle the many-to-many relationships between all these. And we were able to use end printing to create report snapshots to send to the exec about what was being sent to who, where, and when. Reflecting on this project as a whole, it was a great exercise in collaboration between analysts across the Analytics and Reporting branch in the Information Technology Division and the Data and Analytics branch in the Health Economics Research Division in support of the National Incidents Response Team. And this project was a great success. We attributed that to three main things. The first was that we were very strategic. We were outcomes focused, we were rigorous about prioritization, and we had daily stand-ups to handle the changing requirements and the rapidly shifting landscape. Secondly, we were engaged with the executives and the data stewards to maintain data governance and integrity while meeting the rapidly changing demands of the stakeholders. And third, the team consisted of analysts from a diverse range of backgrounds, mindsets, and skill sets, all working together, rapidly prototyping a range of products to meet a common goal. And this was so successful that our teams have continued to work together after this project was over. So again, a big thank you to everyone involved.